Do you like going to the dentist?
Personally, I'd rather give birth without an epidural than to see a dentist.
No one likes going to the dentist. When you retire, you have another dilemma. Do you buy a dental plan or pay cash? Besides the anxiety of going to a dentist, nearly 60% of people say the number one reason they do not go to the dentist in the last 12 months is due to costs.
So in today's video, we will discuss if dental insurance is worth it and who's better off paying cash.
And what about all those Medicare dental plans that you see advertised? We will also discuss those plans as well. And stay tuned to the end of the video where we'll discuss an affordable dental plan where you can choose your own dentist. Yes, no network, and most importantly, have a plan with no yearly cap. No $1,000, no $1,500 yearly cap. Hi, I'm Kai.
And I'm Anne with Gracie, our retirement puppy.
To understand if dental insurance is worth it, let's first understand the differences between PPOs and HMOs. PPOs allow you to choose any dentist typically, and no referrals are required to see a specialist. However, if you go outside of their preferred provider network, you will have less coverage.
HMO dental plans, you cannot go outside the network and typically will be required to get a referral to see the specialist.
And that brings us to the hidden problem with dental plans that seniors have. Many seniors on Medicare end up choosing a Medicare Advantage plan that either has a dental plan included for no charge or very little, or they purchase the Medicare Advantage plan's dental plan. So why is that a problem?
Well, look at this chart. The number 4 reason to not go to the dentist is they have trouble finding a dentist who accepts their insurance. Many local dentists around your area will not accept HMO dental plans, and most Medicare Advantage dental plans, unfortunately, are HMO plans. Most of the time, your network is very limited, like Western Dental type of dentists. But if you are not picky with your dentist, then an HMO plan might be best for you.
That's right. Remember, Medicare does not have dental. Medigap plans generally do not have dental plans included. Many Medicare Advantage plans that have dental also limit the network or coverage. Please keep in mind, the reason to buy a Medicare Advantage plan should be the medical portion of the plan. If you're buying it primarily for dental, you might be disappointed.
Now let's go back and talk about the number 1 problem with dental plans, and that's cost.
Costs can be broken down into 2 categories: monthly premium and out-of-pocket costs, which is after your insurance has paid for your services. Now, believe it or not, the premium is not that expensive for most dental plans. They range anywhere from $30 to $70 per month in most areas for both HMO and PPOs.
So what's the problem? It is the yearly cap or max.
Please note, Anne's not referring to the max out-of-pocket that you pay.
Right. The PPO's yearly cap or max we're referring to has to do with the max coverage your plan will pay. Most plans will not pay after you hit $1,000 or $1,500 max out-of-pocket.
We're also only referring to PPO plans and not HMO plans.
Yes. Most HMO plans do not have a yearly max unless it's part of your Medicare Advantage plan.
I'm sure some of you have already been in a dental chair where the dentist points out that you need a crown. Then the dentist looks at your coverage and says that you will have to pay 100% for the crown since you've already hit your yearly maximum out of pocket. Let's do the math to see how ridiculous this looks.
Now, before we continue, if you are enjoying this video so far, please click the like button and subscribe. This tells YouTube to push this video to other people and really helps us to grow our channel. And as a thank you, here's a picture of Gracie stealing our mango peel.
It looks like she's sticking out her tongue at us.
Okay, remember most dental plans range from $30 to $70 per month. We also have to add a deductible of $50 to $100 on most dental plans. If you pay around $460 to $600 per year, including the deductible, your max coverage is typically around $1,000 for the year. If you pay around $600 to $900 per year, including the deductible, you will typically have a max around $1,500 for the year.
Yes, the math just doesn't make sense, does it? Why would you pay a premium and get $1,000 to $1,500 in coverage? Remember, your teeth, they're not falling out every year. Well, at least I hope not. I'm sure there will be many years where you only need cleanings.
However, some think the yearly max is not a big deal and say, well, I never hit my max, so I'm okay with this dental plan. But think about this. Would you buy this type of car insurance? In other words, imagine your car insurance premium is only $500 for the year, and they cover 2 minor dent repairs per year. That's like 2 dental cleanings. But if you're in a car accident, they only cover a max of $1,000. Would you buy that car insurance? I'm pretty sure you won't say, well, I typically don't hit my max, so the plan is still worth it to me.
So in our opinion, if you're in an area that only has a PPO with a max, it might be better for you to just pay cash, unless there's a plan with a higher max or no max out of pocket.
So did you catch what Kai just said? Yes, there are 2 PPO plans that we recommend. One that has a higher cap and the other plan that has no yearly cap.
Yes, more on that in just a bit. But the second problem with most PPO plans is the waiting period. Now, there is one with no waiting period, which we will reveal in a bit. But for the most part, there's no waiting period for preventative services like cleanings, x-rays, and exams. There's typically a 3 months waiting period for minor work such as fillings and basic tooth extraction. Finally, there's a 12-month waiting period for major work like root canals and crowns. The waiting period starts from the effective date of your policy, not from the time the dentist finds your problem.
Right. You might see some plans that say no waiting periods, but be careful. Those are typically HMOs or discount-only dental plans. So as mentioned earlier, here are 2 PPO plans that we recommend.
The first PPO dental plan does have a cap, but at least the cap is $2,000. What makes this plan unique, however, is that it is a PPO, not a discount plan, not an HMO, that has no waiting period. Now, the benefits are limited in the first 2 years, as you can see here in this chart. But for a plan that has a cap, it is perhaps one of the best. At least the cap is $2,000 compared to the usual $1,000 to $1,500 that most PPO dental plans have. Again, this is one of the few, if not the only one that we're aware of that has no waiting period for any major work that is not a discount and not an HMO plan.
And the next plan is the one we recommend the most. Why? Again, it makes no sense to pay for a dental plan with a low cap of $1,000 to $1,500 with an overall yearly premium of $460 to $900. This dental plan has no deductible, and here's the key point. This PPO plan has no yearly cap. If this is available in your state, this is the plan we would typically recommend.
How does the premium compare to the benefits? Well, the premiums range from $30 to $56, all with no yearly cap. Their best plan, which is $56 a month, pays 100% for cleanings, and check this out, 70% for all minor and major work. Sorry, new implants are typically not covered, but repairs and extractions can be.
There is a waiting period, 3 months for minor work and 12 months for major work. Now, even though this plan has a typical waiting period, what makes this plan worth it is there is no yearly cap. Again, they do have 4 levels ranging from $30 to $56 per month to choose from. But is skipping dental and paying cash better? Kai will discuss that in a bit. Now, you might be wondering why we didn't say the names of these insurance companies. We don't discuss the insurance companies' names because we need to check your state's availability. So give us a call and we can see which dental plan is right for you. Regarding guaranteed income and healthcare, we represent over 50 plans and assist in 50 states. So give us a call.
So should you just pay cash? Well, if you're the type of person that has had no fillings, no crowns for years or maybe even decades, then paying cash might be best for you. But wait, there's something else to consider. The problem with paying cash is most people end up seeing a dentist once a year or even longer. I'm guilty of that. When we first started our business 18 years ago, they didn't have these 2 plans we just discussed. All dental plans were junk. So I paid cash. Well, thinking I could save money and I have pretty healthy teeth, I pushed my cleans to once every month and then once a year. I wasn't consistent. I don't have good teeth like she does. Then I eventually needed my first ever root canal and crown. Now, no dental plan will cover me right away, which makes sense. Why would they? So after that, I told myself I will never miss my 2 cleanings ever again. The problem is, we cannot avoid all the sugar, processed foods, and starch in our diets. I mean, come on, we need to enjoy life, right? So that's the problem. When we don't have insurance, we tend to be cheap, or some people say frugal, thinking we're saving money. But in the long run, you end up spending more money since your teeth end up with more major work that needs to be done. That's why insurance companies have a waiting period, or at least limitations on the major work at the beginning. Bottom line is this. If you are religious about getting your teeth cleaned twice a year, and you have very healthy teeth, then it's perhaps better to just pay cash.
So what's the best dental plan for you then? If you're not picky with your dentist, the HMOs might be a good fit for you. And if you hate seeing a dentist and are picky as to who gets to look into your mouth, like me, then you might want to consider these two PPO dental plans, one with no waiting period and the other with no yearly max. So how about you? Do you think it's worth exploring the 3 plans we discussed?
Or is paying cash better for you? And please be careful with all of those misleading Medicare ads that advertise free dental, free vision, free grocery benefits. That's why we made this video here, to help you not be misled by all those ads.
Again, please help us grow our channel by clicking the like button, subscribe, and share this video with others.